It's time for Global Insight, where we speak to experts from around the world on issues making headlines. Extreme heat across Europe is leading to raging wildfires, infrastructural damage and disruptions to power and transport. But more than anything, the scorching weather is causing a growing number of people to develop heat-related sicknesses and it's even leading to fatalities. Portugal, Spain, Germany and Britain have already accounted for over 2,100 deaths over the past 2 months. And there's growing concern that the numbers will grow as climate scientists say that heat waves are going to become more frequent as well as more intense and prolonged. To discuss the dangerous impact of extreme heat on human health and what we can do to keep safe, we connect with Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter's Medical School. Hello, Dr. Pankhania. It's lovely to see you again.
Hello.
Right. Thank you for staying up for us over in England. And well, we're hearing these very concerning reports about the growing number of heat-related fatalities. And well, my first question is, what bodily reactions does extreme heat trigger? And are there certain people who are particularly susceptible to death, other than the very young and the elderly, of course?
So heat stress can affect all ages. Of course, if you are vulnerable at the extremes of age, i.e. the very young, the very old, the risks are greater. But having said that, vulnerable people in other age groups can also be affected. And the big issue is this: once you have triggered a overheating episode inside your body, it is very difficult to reset and regain control. So the best advice I give as an expert in infectious disease and public health is don't get overheated in the first instance.
Well, in the UK, how are authorities really dealing with the rise in the number of heat-related illnesses and deaths?
So we've had public health information messages, but the big issue in the United Kingdom and Europe is we are not used to heat waves. And because we are not used to heat waves, people think they can do certain things which are dangerous, such as go out in the 11 to 3 p.m. sunshine when it is really strong, do exercise, and also get heated up in their homes. And especially the elderly who haven't really encountered these heat waves before in the United Kingdom most of their life. So they're not used to it, and they can get slowly, surely heated up. And that's why the public health messaging, especially to the vulnerable people, is look after yourself, go into the coolest part of the room, keep hydrated, and don't get overheated.
And Professor Pankhania, well, the World Meteorological Organization warned that heat waves will occur more and more frequently into the 2060s. Are medical experts like yourself expecting the number of illnesses to grow as climate change continues to bring about extreme weather conditions?
Oh, absolutely, and without a doubt. And it's not only heat waves that are going to harm public health. We will have flooding, we will have droughts, and we will have crop failures. And not only crop failures, but we will have poor quality of our harvests. So our plants stop incorporating things like iron, magnesium, manganese, zinc when the temperatures at which they're growing are too high. So, and also furthermore, we must remember that as the temperatures go up in the northern hemispheres, insects that bring you infections never used to live there. But now that the temperatures are warmer, these insects will start living there. Therefore, in countries like the United Kingdom and Northern Europe, we can expect things like malaria, dengue fever, Zika virus, and other things that we normally associate with tropical countries.
And well, I suppose that could bring about a whole host of other diseases. And well, also, with this heat, many of us experience migraines, other sorts of symptoms. But how do we really differentiate between different heat-related illnesses, such as cramps, and then there's heat exhaustion, and of course, heat strokes, which can be more fatal?
So it's not always easy, because one person's description of I have got cramps in my legs could be another person's I am overheating. So the best measure possible is to monitor your hydration, because when you are heating up, you are also perspiring and losing fluids and salts. So you need to not only have fluid intake, but also fluid and salt intake at the same time, and regularly so. And furthermore, how do you distinguish? Well, it's very difficult, but you can always monitor your temperature, monitor how the hydration of your skin is looking by pinching it and seeing whether it is looking dehydrated or not. Also look at the state of your tongue and see if it is moist or not. Those are simple, easy measures that are given out in public health messages.
And at what point should we seek medical attention?
So this can be very insidious and slowly developing, and sometimes people don't seek medical help until too late. So one of the signs that often presents is headaches, general confusion, exhaustion, delirium, confusion, not with it as you would describe it. And often when those signs are developing, someone should consider, especially during a heat wave, could this be related to the internal body temperature having gone up too high, and what are the consequences? What should I do as a result?
See, and how are heat-related illnesses normally treated?
Very difficult. And this is why I always say, as a public health measure, prevention is always, always better. So don't you kid yourself and say to yourself, well, if I get overheated, I will hydrate myself and get better. It is a very, very, very finely balanced issue. And you could go into a heat-related stroke, coma, etc. So very difficult to treat once you've got into it. It's complicated, but in essence, in summary, it would be something like this. Restore hydration, restore the mineral content of your blood, and then try and cool your internal organs. And cooling your internal organs is not easy to do. It is not a case of, well, sit on some ice and you will get better. It is complicated, and it needs experts in a hospital setting to bring your internal body temperature down and keep your hydration, keep the viscosity of your blood, keep the mineral content of your blood at an optimum level. Very difficult. Therefore, the best thing to do is don't get overheated in the first instance.
Exactly. As you said, prevention is the best measure that we can really take at this point. And, well, it definitely affects us physically and causes all sorts of complications, which you just specified. But can extreme heat also affect us mentally?
Oh, absolutely, because there is not only stress, but there is that stress of I don't know what to do. I am just feeling unhappy. And it may be because you can't go out and about, or your biochemistry has changed. And so we must also bear in mind that it isn't only physical signs and symptoms. There are mental signs and symptoms as well to be watchful of and be aware of and inquire about.
And of course, as we keep seeing hotter and hotter weather, not just here in South Korea, but more acutely in Europe and especially the United Kingdom. Well, Europe lacks air conditioning. We have a lot of air conditioning here in South Korea, where we've been having pretty hot summers for years and years now. But in parts of the world where there's no such infrastructure yet, what do you really recommend that public authorities do to help people really cool down and keep safe from the heat?
This is a very important question you ask, and I'm glad you ask it, because air conditioning is not the answer, because air conditioning is the very thing that contributes to global warming, which then leads to the heat waves, the storms, the crop failures, and everything else we have talked about. What is really important is to build better quality houses. So a better quality house built which shades you from the sun, which is better insulated, which has better heat tolerant, is a much better, cheaper, safer alternative to air conditioning. Air conditioning is unfortunately using up a lot of electricity, and to make the electricity we use a lot of coal, and that coal leads to global warming. So really what we need to do is, instead of resorting to the very simple, quick, short solution of air conditioning, build better houses, and it is imperative, very, very imperative, that governments take action and introduce regulations that the houses will be built with better insulation, better sun shading.
Right, so as we look to measure heat relief, we should make sure that they are sustainable and that they are, not becoming the cause of even more heat waves to come. And well, as heat waves continue, though, what are other practical or systematic ways that authorities can really try and prevent damage to health?
Well, good information is very important, but that information should be sustained and continuous rather than stop and start as happens in the United Kingdom. So we had a burst of heat wave, a lot of information, a lot of advice, and then everything goes quiet. What we need to do is inform, advise, educate, and sustain that information and education of the public. But more importantly, it is now incumbent upon governments. Individuals cannot do it. But if governments were to invest in renewables, renewable energy sources, build better houses, educate people, then we will actually find that things start to get better. Simple measures like planting a lot of trees has a cooling effect upon that street. So we need to plant those trees. We need to give shade in our cities and towns. And all those measures, unfortunately, individuals cannot do, but local and national government can do, must do.
Well, I'm afraid due to time, this is where we must leave the discussion. But thank you very much, Professor Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter's Medical School. Thank you so much for your time today.
Thank you.